Hi everyone, I am Dr. Srikanth Raju, Senior Consultant Vascular Endovascular Surgeon, Foot Care Specialist, Yashoda Hospitals, High-Tech City. Today I am here to discuss with you about an important topic that is called varicose veins. Varicose veins is nothing but dilated, twisted veins in the lower limb are called as varicose veins. Usually it presents in the patients who are in the age group of 25 to 55 or 60 years age group. They can occur both in males and females, but females usually present at an earlier age. And the symptoms associated with disease is such as dull aching pain in both the lower limbs, edema around the foot, hyperpigmentation around the ankle or the lower leg area, and some patients usually have a itching or a scratchiness in their legs. When such things happen, they have a bleeding from the variceal areas, and few patients usually have a non-healing ulcers at the ankle area. When such patients come to us clinically, we examine them clinically, and following that we get a venous Doppler test. Based on these two tests, in few patients we go for a conservative management who has an initial stages of disease. In such patients, we usually prescribe flavonoids as a medication, and at the same time we advise them to wear stockings which help in prevention of progression of disease. When the patients have an advanced stage of disease, in such patients we usually advise latest techniques. Those are nothing but laser, radiofrequency ablation and super glue therapy. When compared to the traditional old age open surgeries, these surgeries are considered as the latest techniques. Why? Because they are done as a local procedures, they are done as a daycare procedures, and immediately after the procedure patient can walk on their own legs and can go home, and from the very next day even he can attend his duties, he can go to his office also. And first 2 weeks we usually ask them not to go for any jogging, running or cycling. Following that, even they can do those activities. And if patients who are having a recurrent venous ulcers, in such patients we might evaluate for a deep venous system problems, and if we found anything in that also, in such patients we might go for a endovenectomy, which is again a small open procedure, and at the same time iliac vein stenting. Depending upon the patient's severity, we usually try to give treatment according to that. As a vascular surgeon, whenever a patient comes to us, we take all these factors into consideration before coming to a conclusion and treating them. If a patient who has to wear stockings in a long-term way, in such patients we usually advise them to wear stockings from morning to night. But most of the patients, what they do, they usually don't follow how to wear the stockings in a proper way. That's why most of the patients will have a progression of disease which leads to the higher grade of disease and leading to venous ulcers. When we try to follow as prescribed, as advised by doctors like us, patients will never have a recurrence. Thank you.